All right, everybody. Hey, good morning. Thanks for coming here to Startup Minot this Thursday. Of course, we're here the second Thursday of every month. And at Startup Minot, what are we doing? Well, we are doing everything we can to encourage and entice and invigorate entrepreneurs, to find them and to help them talk about their ideas, to help them maybe find a mentor, to help them share their story. So that might be something that you do here today. You meet someone new, you share an idea, you believe in somebody's idea. We've learned up here at Startup Minot that having someone believe in your idea can be a pretty big deal. So this is a community-owned asset, and we're here to meet the needs of all who have an idea for their company or business to run. We hold these networking events with incredible guest speakers the second Thursday of every month, and we want to learn from other entrepreneurs, other startup companies, and in turn also how we as a community can help entrepreneurs grow. So your goal, maybe meet somebody new, consider something new, go outside your comfort zone, and we have a lot of partners who help make this happen. We're grateful for them: North Dakota Small Business Development Centers, the Service Basin Planning Council, Credence Energy, the Minot Area Chamber EDC, and many from the private sector who help make this happen, so we appreciate them. And our sponsors, First Western Bank and Trust, as our presenting sponsor, the Minot Area Chamber EDC, North Dakota Small Business Development Centers, Bank of North Dakota Brevera, Town and Country Credit Union, First International Bank and Trust, Cornerstone Bank, Credence Energy Services, and People's State Bank. And we love having banks support our networking event because banks usually go hand in hand with entrepreneurs at some point. So it's great to see that they are here and kind of looking out for these local businesses and people who with ideas that want to make them happen. We are super excited to have our guest here this morning. He's an entrepreneur who has worked hard to make his unique business work for his patients, employees, and himself. Let's give a warm welcome to Dr. Lindell Kemmet.
Thank you, everybody, for coming. I really appreciate this. It's great to have the support of the community here from my wife, some team members, friends. Thank you, guys.
Dr. Kemmet, give me 1 second to read your bio.
Yes, there you go. He's going to talk a little bit about my bio. Thank you.
Yes, so I have a little bit more to say about Lindell before he begins talking.
You can't shut me up.
Very, very eager to shove me aside and just take this thing over. So, Dr. Lindell Kemmet is the founder and owner of Kemmet Dental Design here in Minot. A North Dakota native, Lindell began his career with the Indian Health Service before completing a dental residency and entering private practice. Driven by a desire to do more than traditional dentistry, he founded Kemmet Dental Design with a vision of creating a practice focused on solving complex problems and improving lives. Today, Lindell is recognized nationally as a mentor, educator, and speaker in advanced dentistry, airway health, sleep disordered breathing, and technology integration. He teaches dentists across the country while continuing to practice here in Minot. His passion lies in identifying problems others may overlook and developing solutions that bridge the gap between dentistry and medicine. He believes healthcare works best when providers understand that the mouth and body do not function separately, and he continues to advocate for a more integrated approach to patient care. Now, usually I start with some questions, but if you got something you want to say, no, you go right ahead and break it down for everybody.
Bring a couple questions to me because I don't really have anything prepared. So
that looked differently than unprepared.
So that's one thing I'm good at, is just talking randomly from the cuff. So
I love it. Well, I wanted to drill down on what I read about your desire to do more than traditional dentistry.
Yeah.
And I just want to explore that because most of us have, I think, probably a very rudimentary understanding of dentistry. Mm-hmm. So when we hear something like more than traditional dentistry, and I'm reading here the sleep disordered breathing and the technology integration, there's a lot going on there. So I would love to start there.
Absolutely. So I'm glad you brought that up because there's two approaches to dentistry the way I see it. I've been doing this for 19 years now. I graduated in 2007 from the University of Minnesota. So in those 19 years, I've seen a lot of aspects of dentistry. A lot of us think of dentistry as almost like the mechanics. You go get your oil changed in your car, you know, you go get your teeth cleaned every 6 months. You break a tooth, you need a crown. You know, you start thinking about, I'm going to use this as an opportunity to fix myself, but I just need to get through life. It's almost like, here's my car, see how long I can make this thing last. Doesn't matter if you're buying a Ford or a Mercedes, right? You're just trying to make that thing last as long as you can, and as reasonably cost as possible. That's traditional dentistry model. What I've found over the years is it's not just how we can take what's there and try to make it last. The mouth is the gateway to the body. And so we as dentists have always been looked at as this ugly, evil stepsister of medicine. You go to the hospital and they say, oh, it's the mouth, you better go see a dentist about that. I don't know, podiatry is kind of the same way.
That is so true. They made a Seinfeld episode about it. I'm just saying, the anti-dentites and the whole debate. So like there's truth in that stereotype.
Yeah. But what's interesting now, for the last, probably close to a decade, I have found basically a new calling. I still do traditional dentistry. In fact, Kemmet Dental Design was started on the principles of doing the basics of dentistry. I design teeth every day. I was a trainer for the Same Day Crown CEREC. You may have heard that name before. I was a trainer for them. I was a beta tester. I was one of 100 in the world beta testing that. A lot of what we see now in that system as a dentist, there are two major parts of that system that I actually implemented. I had direct contact with the developers in Germany. But that was kind of like my past life. I've done that. I've got to the mastery level of that. Patients come in from all over the state and other states to get a crown in the same day and go back to their lives. That's great. That's the mechanics of dentistry. But as I'm seeing now, we have an opportunity to look at people's mouths and go, what's happening here? How did you get to this level? What is happening in your body that I could help with? Because medicine, typically, our medical model is a sick model. You go to the hospital when you're sick, just like you go to the dentist when you break a tooth. Now, they're trying to figure out, well, how do we get you back to where you were? I look at things and say, in your mouth, there might be something that I can notice here because you've been developing this from age 5, 3, whatever it is, and now you're 25, 55. You've developed this all your life, and now I'm seeing the damage on your teeth, and I'm saying, I've recognized this before, this is what's happening, but this is why it's happening. And so can we do something to prevent it before you actually get to the problem? Here's the big issue. As I'm talking about this, you can go, I don't know what he's talking about. What I'm talking about here is how we breathe every day. Every night we're going to bed, and how people sit in their sleep patterns, what levels of sleep are they getting to? That all depends on your maxillary complex, your sinuses, your nose, your paranasal sinuses, your posterior oropharynx, your neck, how much loss of structure your tissues will do. If you're snoring, that's all part of this. If you have a reduction in your airway, all of a sudden you're not staying in REM sleep for long enough. You're tossing and turning, you're getting hot at night. You're trying to figure out what's wrong, and you're like, well, I just got to get some coffee. I mean, we got coffee at the meeting. We're a society dependent on coffee, right? Why is that?
That's one of the truest statements you've said at this.
I only speak the truth. So our goal, I look at this and say, can I recognize one of the biggest problems, the epidemics in the world right now, which I believe is sleep apnea? Right now, I believe the numbers are 40 million people that are diagnosed with sleep apnea in the United States. The number is estimated to be about 120 million people. Those are major, major numbers. That's a third of our country if you start thinking about the numbers. Sleep apnea is not something you die of, but yet the number 1, the number 3, and the number 5 killers across the country are heart attacks, strokes, and lower lung disease or blood clots from your legs to your lungs. All 3 of those carry a massive high increase of risk if you have sleep apnea. So was it the sleep apnea that caused these things, or was it the thing itself? Well, I believe very strongly it was a sleep apnea that's putting that number higher and higher into people's lives. It's never going to be the thing that caused it. The heart attack caused the death, but what caused the heart attack? And that's where we're at. So we're trying to figure out how are we preventing this? And in my mind, the easiest way to do it is not take someone who's 46 years old and say, I'm going to fix you, because it's kind of hard. Structurally, we're there. But what I can do is I can take a look at your children, and I can say growth and development is huge. And so that's really where my practice has started to develop more and more, because at a very young age, I wanted to be an orthodontist. And then I went to college and I started shadowing orthodontists, and I'm like, this is boring. It's the same thing over and over again. It's like, okay, we're gonna move the teeth, da, 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 da. Now I look at it and say, this isn't teeth. This is the nose. And so that's what we're working on right now. How are we gonna change the entire complex, nasomaxillary complex? How are we changing all that for the better? Can we take a child who is a tosser and turner, they're hanging off their bed, they're sleepwalking, they have night terrors, they're wetting the bed until they're 12 years old, or whatever it is. How can we help them get through this phase of life and then beyond? Are we helping them when they're 50 years old, that now they're starting to go, you know what, honey, you should really go get a sleep study because you stop breathing at night and it's starting to scare me? Am I helping that person? I may never know, but in my heart, I really do. I want to know that I think I'm doing the best thing I can because I'm helping them breathe, which is exactly what is the treatment for sleep apnea? A CPAP machine. You're gonna force air down your throat, right? Why is that? Well, because everything is starting to constrict. Everything gets looser as we age, right? So you're blowing air down your throat. Can I just make that area bigger? An ENT, an ear, nose, and throat doctor, they are very good at what they do. They are cutters. They look at the nose and they go, how can I make this person breathe better? So they start reducing turbinates. They start straightening out the septum, your deviated septum, a spur, a bone, anything like that. Anything to get you straighter nose, more air capacity. What I do, I just make the nose bigger inside. You know, you don't see it out here, maybe a little bit, but inside, as a dentist that actually helps growth and development, I can take a child and I can look at the numbers and say, you need some help. I don't want to just put the teeth in the right place because you're crowded. I want to make the whole complex bigger, and all of a sudden the teeth are easy to move. I don't have to work too hard at that point. So it's orthodontics to the extreme. It's really truly orthopedics. You're guiding growth all the way through this. So this is where my change has really has been affected, and it all started with my daughter. 10 years ago when she was born, she had a tongue tie and we couldn't figure it out. Couldn't breastfeed, couldn't really thrive. And so started this whole journey, got really deep into it, and then just took off from there. So
this sounds really, what you just shared is profound when I think of the scope of a dental office. Okay. And so the notion, as you say, solving complex problems and improving lives, there is a part of this that if somebody wants to come to you and get more than dentistry, this is, you can solve problems through people's mouth. Like that's fundamentally, and you're getting up into the capillaries. So just so somebody might understand, if I have breathing problems, if I have, what if I have allergies? Is there a possible link that you're finding for people with otherwise problems that we would normally go to a physician for?
Yeah, absolutely.
That's what you're looking at.
Absolutely. You know, it almost starts as when everything is constricted, your body will protect you. Your body knows, your brain says, I'm gonna make this person run any which way possible. And whatever you've given it, your brain will work around that. And so imagine that your tissues start to get a little floppier, and now you're laying down in bed, and then your airway is a little bit constricted, it's a little flatter, you're snoring more. How's your brain going to solve that problem? Well, you clench, you grind, you hold your teeth together, because that's like going to the we were just talking about the gym, right? You flex, you work those muscles out. Same thing with your throat. By tightening your throat, you're getting them out of the way. So that's where the clenching comes in. As you grind side to side, that's letting the tissue not stick to itself, like moving it forward and giving yourself a little bit more room. Every day I see people that have wear patterns on their front teeth, and I say, okay, move forward. Okay, now way to the right, no farther forward. And I can see where those teeth line up, and they're like, oh, I don't do that. Of course you do. I'm seeing it again. I can visibly see this in your wear patterns. I can see people that have massive cracks in their teeth. And dental insurance I'm just going to talk about that for 2 seconds. Bane of my existence, because it's just, if I crown a tooth because I see a crack on it, they look at it and say, well, we don't pay for cracks. I say, that's fine. Like, if it didn't break, I don't really care. What I'm telling you is you're standing on the railroad tracks and a train's going to hit you. A crack in a tooth is caused by something. So what is the cause? Well, right now we have to fix the tooth because I don't want to see you break this tooth in half so you lose it. So we're going to put a crown on it, and then we're going to also then figure out how we can stop clenching. So I do a little bit of both. That's where this vision comes in. And it's really hard as a dentist to almost stay in this scope of dentistry. People say, and that's where you were going with it,
well,
wasn't
no, it really
Yeah.
was. I was going to ask, because you're a dentist now, this seems like you are traversing outside your realm,
Totally.
right? And how do you, number one, how do you pitch that to your business, your employees, maybe your investors if you have them, I don't know, but that's a big pivot or a big addition. And then how do you how do your colleagues perceive that as, or even other doctors? Are they saying, look, stay in your lane, dentist.
Yeah.
This is not what you do. Stick to the teeth.
There's so many, there's people that say both. I was talking with an orthodontist. So I teach courses down in Arizona about airway growth and development. And I'm going to say probably 5 years ago, I was showing an orthodontist who was taking the course from us. I was showing him what I was doing for a child here locally. And it was kind of the first, like, wow, I can't believe this just happened. And we had some results that we didn't even expect, like highly, highly positive results we didn't expect. And when I looked at it, I showed him what was happening. He looked at me and said, who told you you could do that? And I said, what do you mean? He said, where's the research on that? And I said, there is no research on that. That's the point. Like, as a dentist, I'm able to look at things and say, I think this is possible. And I said, who do you think does the research? Who do you think starts the research? Is it just like, does it just show up? Somebody has to be the innovator. And so in my career, I've looked at I've actually taken this little opportunity to kind of lie in bed and go, all right, what am I going to talk about? And as I've learned from my coaches and other people, I've done many personality tests, and years ago I was a heavy D directive, right? Like, I'm going to do this. I probably wouldn't have been a business owner if I wasn't a high D personality. And as time has gone around, like, I just recently took the test again, and I'm like off the scale I. Why? Because I'm not only innovating and I'm taking the space that I'm in, but I want to take this and say, what's next? How can I help the next generation? How can I help the people that don't understand this? And that becomes high I. Those are the teachers. Those are the ones that say, what are we going to do with this? Because it's not just me. I'm part of an echelon of people that say, we're going to start spreading this word. We're like gospel spreaders of this. I've been teaching this for 8 years now down in Arizona, and now I'm starting to get recognized. People are starting to say, I want you to talk about this. I want you to join our event. And because there's probably only maybe 100 of us, 200 of us across the country that are dentists that are really focusing on this, which, to your point, locally, it puts a big target on my back. Physicians might say, stay in your lane, because they're like, it doesn't matter. Orthodontists might say, it doesn't matter. But
you say something to a patient, and then they're like, well, my doctor said this. And then all of a sudden.
And then there's butting heads.
Yeah.
And so you have to take this pragmatic approach and say, we understand where we were in medicine, and now we also have to look at it and say, what's next? It doesn't mean we've done things wrong, because that's always the approach people think about, is like, well, that means I did it wrong all these years. Well, we don't know what we don't know. I can tell you I've done things wrong, because as I go through treatments, I'm like, man, maybe I shouldn't have sent that tooth for a root canal. Maybe I should have just taken it out, because that tooth was cracked. And no wonder it didn't last 2 years, because I made the wrong diagnosis. It's exactly the same physically. I can see it, I can test it, and it tests the same, but really I should have known that there was no decay in that tooth, it was just cracked. I should have just taken it out. So we learn as we go, right? So it makes dentistry more integrating into medicine, but there's a lot of people who push away from that.
And then furthermore, how do you get this message out to clients who are inevitably going to be your customers? Because here you are offering dental services, and now you're expanding into these integrative technologies, into things that many people haven't heard of, and in a place where nobody is seeking that type of treatment. So what's been the process for marketing that? Are you trying to, I don't know, are you upselling current clients on these new techniques? Or how are you getting that message out to people who need to buy into this?
What's really cool is our patients who have been with our practice for many years. I took over a small practice that was we're gonna just kind of keep this car going. If we lose a tooth, it's okay. But we still got the rest of them. We've taken that clientele base and helped them understand what we do, and they've gone through the changes with us. How do I sell it? I don't advertise for it. Although you are going to see this month, our billboards are going to say, snoring isn't normal. I mean, we're starting to do that. But really, until you come into the office and just come in as a new patient, and most people don't know this is what my focus is. Most people think that just this is the general dental office. It's really nice, so they do same-day crowns. That's great. And then we talk with people, and I see their CT scan, I see their skeleton, and I'm going, okay, how do you sleep at night? Does your wife say you snore? Are you tossing and turning? Are you up at 2 o'clock in the morning and then you just can't fall back asleep? Are you waking up in the morning and it's like, oh gosh, that alarm got hit 5 times and I just need to get myself a cup of coffee? Are you that person? I look in their mouth and I see the cracks in their teeth and I see the wear patterns, and maybe we should see an ENT. About 8 or 9 years ago, I got a 1-star review because I told a new patient on a new patient exam. She only came to me once. She gave me 1 star because I said, have you ever thought about taping your mouth shut at night? She started crying, and she thought I was going to kill her. But that's, and no one has ever died from a piece of tape. My wife sleeps with a piece of tape over her mouth a lot.
Look, I've seen those ads pop up in my algorithms.
And now it's so common.
If we all still had cable, you'd see that as an infomercial quite regularly these days.
A friend of mine just invented a new mouth tape. We're going to be starting to carry intake breathing, so strips on your nose that can pull your internal nasal valves out so you can breathe better. All of these things are just it's just a way to understand how you are. If you tape your mouth shut and you can't do it, you try it for a week, try it for 2 weeks, and it's off every night, or you feel like you're in a panic and you're sweating.
Right now, I hate the idea of taping my mouth shut. Instant hatred for this idea, but I've seen it, and I would I get a pretty good sleep score. I wear my health watch, I do, but I do know I also snore sometimes.
Yeah.
I don't find myself lacking in rest. I don't wake up wanting coffee immediately or any of that. But I do know that I would like to breathe better through my nose. I know I would.
It's a use it or lose it.
Right.
Your nose is truly use it or lose it.
If I'm a new patient that doesn't feel like I need dental work, but I feel like I want to breathe better through my nose, do I call you guys?
Yeah, absolutely.
You're an option.
Absolutely.
If I'm somebody who I am somebody who has been told you need a sleep apnea machine, but I don't want to commit to that, and I want some alternative ideas.
Yeah.
You're an option.
Yeah.
These are some of the other, some of the other things that people might come seek you out for, or should come seek you out for, if they've hit a crossroads in not being happy with whatever they're receiving or the answers they're getting. What about a child with asthma? Like I think about asthmatic children a lot. Is that something perhaps through your practice and the work you're doing that you would help with that maybe a traditional physician hasn't been able to work with?
Yeah, any little thing, there's multifactorial issues there. So you want to keep working with your physician, obviously, but is there something that we can help with? Can we help them, the parent, understand how their breathing is affecting them? Can we expand their palate slightly in order to, one, get their crowded teeth in the right place? Maybe they have a tongue tie, maybe that tongue is low in their mouth, so they're breathing through their mouth too easily. There are three top things. If you can keep your tongue on the roof of the mouth, lips closed, breathing through your nose, typically you're going to develop pretty well. If we look at our children and they're all laying in bed like this with a craned neck, what they're doing is they're doing everything we do in surgery. We're straightening out the neck, we're pushing the jaw forward and allowing that airway to be a positive airway. So you had mentioned about sleep apnea devices, so CPAP machines, the development of it was literally they took a shot back and stuck it on a bulldog. That's how they developed it. They're like, does this work? And it worked. And so now we have a CPAP machine. It's like one of the only things that we have in the world that was just like, let's try it, and it works. The problem is you didn't change anything about the structure. And that's what I teach in Arizona, is all about how can we turn ourselves into something that we don't need something like that. Not everybody can do that, and sometimes it's extreme. Sometimes we actually go to the oral surgeon and we widen the maxilla and we bring the jaw forward and we cut the jaw and we slide it forward and put everything forward, because that's what you're doing at night, right? I talked about grinding your teeth, sliding your jaw forward. If we can get the nasal maxillary complex a little wider, widen the base of the nose, all of this stuff is a positive increase in your airway. All of a sudden, you might not have the problem anymore. So is it something we can all do? Probably not. This is, sometimes $50,000, $100,000 and a year's worth of work. Do you want to go through surgery to do something like that? Maybe, maybe not. It's really dependent on the person and how extreme you want to go. What I usually talk with people about is that there's options. I take a very pragmatic approach to dentistry. I want to focus on saving the teeth, and really truly I'm practicing dentistry because I'm seeing the effect on the teeth and I'm saving the teeth, and sometimes I have to keep digging in and finding, well, what's the problem with this? And that's where the referrals go. We start talking with physicians, and it's been a long road to get physicians on board here in town. It really has, but we're getting there. Now the physicians are starting to trust me and go, you know what? It's been a long time. He's been preaching this for quite a while. I get it now.
And other people are seeing it. You're being asked to come speak in places.
Yeah.
Like there's a lot of people with forward-thinking ideas need to be, I don't want to say automatically rewarded, but we need to let them have the effort. We need to let them deploy that effort. We need to see if it's going to work. As your reference to the research, where do you think it comes from?
Yeah.
So,
and that's what we're doing right now. We're actually doing some radiographic research right now. It's not we're not researching anything that we're changing on people and just seeing where they go. That's like research board stuff, and we're not touching that. But what we're doing is we're saying, how about somebody who's 60 years old? What are some of the measurements that we're looking at? Because nobody truly is looking at this. What are the endpoints? What are the goals that we're trying to find? If we expand, what are we shooting for?
So before I pass it over to some audience Q&A, I do want to ask, what are maybe like 5 general tips you would pass on to somebody? If you've got 3 to 5 general tips, what can I do now to help myself with some of the things that you're talking about?
Yeah, absolutely. So as I said before, remember the big three I always talk about. Tongue on the roof of your mouth. If you're sitting here right now, where's your tongue? Should be on the roof of the mouth, just kind of lightly suck to the roof of the mouth. That's where it should always be. The tongue actually helps form the upper arch, which is the base of the nose. The bottom teeth follow that. So tongue on the roof of the mouth, lips closed, breathing through the nose. That should be super, super common for everybody. It's not for me. I breathe through my mouth a lot. Us talkers, I'm a very big talker. You take rescue breaths, you do that. So trying to focus, slowing it down, breathe through your nose. As I told before, is a use it or lose it. The less you use your nose, the more congested, the more clogged it will be. Paranasal sinuses need to get cleansed with nitric oxide. Keep it clean. So anyway, that's a big one. If you're seeing children toss and turn, if you see the bags underneath their eyes, the bags is very commonly the tongue is not working properly. So seeing someone like a myofunctional therapist, someone who literally helps teach them exercises to utilize their tongue and strengthen their tongue and put it in the right place. Those are huge exercises and something that is invaluable to me in dentistry, because I can change structure, I can't change muscle function. That takes therapy. That's the working out. That's the hard part of dentistry. And that's, luckily we're having some speech language pathologists and it's starting to get taught in school, but it does take a long time for that to happen. And honestly, I always tell people, just go to your dentist and ask. This has been, a 10-year journey for me, but there are other people out there that have been doing it for 15. There are other people that just learned about it. They've been hearing about it and they say, I do airway, what does that mean? Well, some people are looking at it and saying, I kind of understand what's happening here, but I might not fully practice it. Do you recognize the pain in the teeth? Do you recognize that maybe we should help this person that has a CPAP machine utilize it better by utilizing a mandibular advancement device? Bringing that jaw forward a small amount will help the jaw help the airway actually be in a positive manner. What's another one? I don't know, just always look. Don't ignore it. Ignoring it can cause some major issues. I've been lucky enough to be in this town and have many friends who are a little bit more mature than me. I'm in a group of singers called the Heritage Singers, and I've lost friends, sudden heart attacks, and I look at it and go, gosh, I want to know if I could have helped that person. And so those are the things that start charging me up and say, I almost have to talk more and more about it. I should advertise more, but I don't necessarily want the target on my back. But I'm starting to get to that point of saying, I don't care anymore. I think people are more important.
Last but not least, as a dentist, he wants you all to floss every day.
100%. I always tell people, brush, floss, water pick. BFW, alphabetical order.
Boom.
You cannot miss that.
All right.
See it every day.
Questions out there? What do you got?
Yeah.
In thinking about, what the repercussions from what your analysis might be, how's the insurance work into this? How are they going to prove, they may say, well, I don't think that this is a necessary type of thing to be able to cover.
Yeah.
Is that something that you've run into?
Absolutely. Usually in dentistry, insurance is almost a joke. My wife could tell you a little bit more about that, but it's virtually a coupon.
I don't think it stops being a joke just at dentistry.
Yeah. And so
Healthcare
if you think
in
about
this country
if you think about medical insurance versus dental insurance, medical insurance is really you pay your copays and you pay up to your deductible, and then anything past your deductible, okay, that's on them. Dental insurance is the exact opposite. You pay 50% or 20% or whatever your copays are, all the way up to the maximum, which might be $1,500 or $2,500, whatever your maximum is in your plan. And then after that, it's all you. So that's 180 degrees opposite. So if we're relying on dental insurance to help with any of this, no, we're really not. So what our goal is to try to help the medical providers. If this is something that is truly an issue, sleep apnea, as I was telling you, is such a big epidemic. Can we get a sleep study to prove that there's something going on? Is there something we can do medically? An ENT installing Inspire or something like that helps people bring that apneic level down? Is there something we can do to help support that device to work better, whether it's a CPAP machine, whatever kind of surgery it might be? Those are usually on the medical side. Again, my job is just to help support. Can we get a sleep apnea device approved through medical? Yes, but it's usually really hard. And it costs a lot of money. So a lot of dental providers will charge a lot more just to get about the same amount of money out of you anyway, because that's really the issue and the struggle. So it ends up being, you pay $3,000 out of pocket for something to help you, and really that's probably the smartest, easiest, cheapest way than trying to help your medical side. If there's a true dental surgery that needs to happen, I was telling you about surgeries that could be $100,000 and you got to go across the country in order to do it. Usually that's a medical side. Not many people just have $100,000 in their pocket to do that kind of stuff. Yeah, right. So that's where we involve the physicians. That's where we try to help those out in that manner. So yeah, those big things we're not doing here locally in town. Those are the big ones that tend to go off somewhere else.
Who else got a question out there?
Yeah.
Mark?
You talk about the business side of being different than everybody else.
Yeah.
What does it mean to be an entrepreneur who doesn't fit anyone else's model?
Yeah.
You look around, you're like, no one's
Yeah.
doing what I'm doing. How do you think through the business side? Paying the bills, the attracting the employees, the keeping the lights on.
Well, I tell you what, that's probably the hardest part of what I do.
Keeping the employees or paying the bills?
Yeah, a little of both. I tell you, in dentistry, dentistry is a model of business. You could go out and drill, fill, and bill. I mean, that's the joke, right? And all you do is you scale. And you make more money. There's dentists out there that are buying multiple practices, and they're starting their own dental service organizations, Aspen Dental type things, where they just have multiple practices. They have associates working for them doing the same thing. I've built a practice of me. I have built a practice that is almost impossible to find another dentist to come in like me. Because I've been doing this for so long, I have to teach them every little step along the way. I take tons of CE. In North Dakota, you need 32 hours every 2 years. I take about 150 hours every year of CE, and then I teach it on top of that. And so the level of education that I have and the ability to look across different fields and say, oh, I can take this and multiply it and add it to this, I've really made a practice that is probably worth nothing. As being an entrepreneur, I had to be on my own because of my way of thinking. I had to do it on my own because if I had a boss telling me to do dentistry, I wouldn't have been able to do what I do. And so as a business owner, truly I'm doing what my heart desires because I saw something that I knew I could help people. So I always tell people, if I planned my future out and I said, okay, I'm going to dental school, I graduated in 2007, where am I going to be in 2026? It wouldn't have been here. There's no way. How would an infant say, where are you going to be in 20 years? Like, well, I'm going to go to the moon, I'm going to do this, like that's the level that we are in our lives. So I always say, direct your decisions, let God guide your life. And so God has taken me to where I am now based on all of the paths that I've taken, the mistakes I've made along the way. All of those bring me to exactly where I am, and this is the happiest that I could ever be. And so as a business entrepreneur, I've been part of Goldman Sachs 10,000 Small Businesses. I've done the things that I can try to do to be an entrepreneur, but then I realize the best way to do this is to be out there and say, hey, this is what we're doing, this is the mentality we have, this is the research we're doing, and I'm going to attract somebody sometime in the next 10 years, I hope, that also says, I want part of that. I want to do everything I can to be part of that in Minot, North Dakota, because when I'm teaching these classes, I'm teaching them next to the leaders of this field. They are the people that understand it and know it. And here's this dude from Minot, North Dakota that fixes teeth for farmers. But I have this level of vision for people that I really think is important. And I was talking with Grace about that yesterday, and she said, there's a reason why they like hanging out with you. Not because you're just from North Dakota and you just go to these things for fun. It's because of that level of innovation. As we talk about things, as we start to talk about things with each other, we really do raise the field. I talked about multiple levels. Elon Musk wouldn't have put people in space if he didn't start Tesla. The materials that he developed in one space had to go to the other. He couldn't have done that without, done SpaceX without his internet company. And all of these things had to work together. And so he had to bring the right people on board in order to do what he did. So as smart as he is, he was even smarter by saying, I need help and I need to develop this and I need to do it on my own. He's a high D, but I also think he's also changing because I'm seeing what he's doing and he's bringing himself people on board to help along the way. And that's where I'm at in my career as well. So I think it's a great question, Mark.
That's awesome, and I think very beautiful, very admirable response in the things that you're achieving, and the seeing the signs, following them. You really, when I was hearing you speak about that, it reminded me of my favorite book, The Alchemist. And if you haven't read it, everything that you just described is what that book teaches. And it's been a guiding light for me in my journey as well. So awesome. Really like that answer. Anybody else with a question today? Sure, Joanne.
Yeah, so I'm retired, and some days I act retired, and other days I'm looking around for what needs to be done. One of the ladies that I help, and I went back to early on in your thing, you said mouth is connected to the body. Well, right behind the mouth is the mind. Mm-hmm. So one of the ladies that I work with, I help her get to work and back if she, but one of her earlier partners had knocked her teeth out. Mm-hmm. Well, so when I say it goes to her mind, people like that isolate so that they, and then the community as a whole looks down on somebody without a nice set of teeth.
Yeah.
And then you see these commercials on TV where they're fixing this or fixing that. In your network of dentistry, is there any help for a kind of a disadvantaged person like that, or are they just stuck with their situation?
Yeah, there's actually a national program called Donated Dental Services. It's a play on DDS, Doctor of Dental Surgery. But Donated Dental Services, if they're truly in a place that they can't afford or work with a dentist on that, they can apply to that program, and usually what they'll do is they'll work with a laboratory and a dentist to get them the needs filled that they can. Another friend of mine, he started a company, I think it's called Hero Dental, very similar, just depends on what part of the country you're in. There are a lot of donated dental service places, but dentistry has become really expensive. It's
That's why
tough.
You like to help people, but you can't afford to help people.
Exactly. Yeah, it's really interesting. We talked about insurance and hit on that a little bit earlier. Back in early 70s when dental insurance started, the maximum allowable was about $1,000. Well, geez, you could get 4 or 5 crowns for $1,000. Now you can't get half a crown for that. It's like it's crazy that now it's just a business. Just go to Chicago and look up, and you'll see multiple buildings with insurance companies, but they're not just insurance companies, they're dental insurance companies on the side of the buildings. So it's really interesting where we are in dentistry, that it's really truly become a business. I've tried to work so hard to help people, and it is tough because my overhead is probably a little higher than most because of the lack of business acumen that I might have, because I really truly follow my heart on what I want to do with people. And I probably give away too much. My wife would probably say that.
Yes.
We do offer options. We're trying to do the best we can to help people out, because we see those situations and they're really tough.
I was just wondering if you could talk a little bit more I guess this is just your perspective, is more than just in dentistry. The comment that you made earlier about not advertising.
Yeah.
You know, my husband and I always wonder, like, how, like, I didn't even know that business was there. How are they even surviving? And in connecting to the dentistry, thinking back, my daughter, when she was first born, like, you know, well, I breastfed both my kids, but my daughter, like, I'm like, okay, I just gotta try to get her about, would not, nothing, no. When she was 14, the dentist finally said, oh, well, she's slightly tongue-tied. And I was like, it like hit me like a bolt of lightning. Is that what was going on when she was an infant as to why? And like, and so then the not knowing that that could all be connected to think that, you know, maybe there's more going on in there as far as issues that she's having. And then just to realize, wow, for 14 years, so now she's had some sort of an issue for 14 years and didn't even know about it. And then it's just kind of tossed out like, oh yeah, this is what it is. And so it's like, well, if there's more knowledge as far as, you know, things like that, like how do you know those things are connected? So I was just wondering, you know, how do you, I don't know, with the lack of advertising, how do people know that that's a possibility, whether it's dental or something else?
Right, and another great question. For me, I could throw that out there and advertise that we do tongue ties on children as early as the first day out of the womb, which we've done, and it works great. The hard part is tongue ties, I believe, is one of the biggest things that's happening that causes this issue, because there's either a lazy tongue, which is rare, it gets lazy as time goes on, or there's a physical limitation of the tongue. Especially with prenatal vitamins and things like that, we know that it's actually developing collagen to help other places, but one of the main places it goes is right below the tongue. So we're seeing more of those, and in general, we see a lot of people that say, that's overdone. It's overdone. So people push back a lot. You know, it's almost like, you know, a lot of dentists will say, it's gotta be a tongue tie, it's gotta be a tongue tie. And the physicians are saying, it's fine. You know, the pediatricians will say, they're fine, they're thriving, they're growing, they're still growing, they're getting better, they're in the 90th percentile. And so all of a sudden, since they're growing, it's fine. You know, here I am, 6'7", always, they never gave my parents a percentile. They never gave me a percentile for my daughter, who's now 10 years old, because she's huge. Did she have a tongue tie? Yeah. Did she thrive? Great, she did just fine. She just couldn't do certain things. And we have an issue with her mouth. And so we had to develop technologies in order to help her breathe now. In the last 4 months, she has gone from being a tosser and turner, snoring, and all of the things that children should never do, sleeps like a baby now, all because we actually finally got to the point of putting some screws in her mouth and opening up the nose. It's all about breathing. So.
But I think too, just Minot is such a wonderful place to make connections, and we're finding the lactation consultants at Trinity are seeking us out frequently now. So
yeah, lactation consultants and things like that, it almost becomes like a grassroots network. And as I get a few more hairs on my back, I'll probably advertise a little bit more for that kind of thing. We are usually at a capacity already. You know, one of my assistants is right here right now, who I did release her tongue. She actually begged me to.
don't tell that story.
So it's really interesting to be able to see what we see. And is it something that has to happen? On so many people, yes. Without that tongue going up to the roof of the mouth and putting the pressure to build the arch in this nice form, we see the crowding, and that just is a cascade event. So usually the tongue tie is about as far back as I can go. You could talk about nutrition and things like that also cause inflammation and keeping the tongue low, but yeah, keeping the tongue low is like about as far back as we can go. That really stops the structure, because truly muscles always win. Muscles help develop our bodies. Why do people like me have a forward posture? Well, it wasn't just because I was trying to listen to my friends in grade school. That was part of it. But it was also because as I do this, you straighten out that throat again, right? So when you see somebody that's either doing this or they're walking with their nose up, it's called lordosis, they're straightening their airway. It's the elevator diagnosis. You want to just talk to the parent and say, come see me. I'd love to take a scan. I'd love to see if there's something we can do a little survey and see how they're breathing at night, how they're tossing and turning, if they're tossing and turning. 95% of the time we're right on. So.
Okay, well, guys, that's our time with Dr. Kemmet this morning, but if you do have questions for him, I'm sure he'll stick around for coffee. Again, Startup Minot, second Thursday of every month, so we do hope to see you here next month. Be a friend, tell a friend. Let's give it up one more time for our guest.
Thank you.